they want to do this. They want to do this. They're doing things that frankly, they don't need somebody to walk over there with a hammer and say, do it. They are getting it done. They're making tremendous amounts of equipment, tremendous amounts. And when this is over, we're going to be fully stockpiled, which they would have never been except for a circumstance. This was something that nobody has ever thought could happen to this country. I'm not even blaming. Look, we inherited a broken situation, but I don't totally blame the people that were before me and this administration. Nobody would have ever thought a thing like this could have happened.
All right, YouTubers, welcome to Diverging Perspective. This is your host, Patrick Penry. And folks, the official narrative of this coronavirus pandemic from Donald Trump, from the government, is that they could not have foreseen this event happening. There's no way they could have prepared for a pandemic because they couldn't have foreseen it. They couldn't have known the possibility of a pandemic or bioweapon attack, and thus they were unable to be prepared for it. That's why we're experiencing what we're going through now. The not enough hospital beds, not enough equipment, lack of organized response from the government. Folks, this is an absolute lie from these people. Let me show you just how bad they're trying to pull the wool over on us, folks. Let's go back to 2001. There was a pandemic bioweapon attack simulation exercise called Dark Winter. In 2001, you had one called Tripod 2, likely never occurred. It was scheduled for September 12th. In 2005, January 14th, you had what was called Atlantic Storm, another bioweapon pandemic exercise simulation. In 2018, on May 15th, you had the Clade X exercise, which again, simulation of another pandemic bioweapon attack. And in 2019, as many of us are coming to find, October 18th, you had Bill and Melinda Gates had the Event 201 tabletop exercise simulation of a pandemic. It gets really interesting, folks. Let's look into these. The tripod I came across when I was looking up information on the drills that occurred before some of these major catastrophic historical events that we've been experiencing. So in researching the Vigilant Guardian and plane hijacking drills that took place prior to and on the day of 9/11, I came across a reference to Tripod 2. This was a biowarfare exercise scheduled for September 12th, 2001 in New York. Likely never occurred because of the terrorist attacks, but you can read about this in Michael Rupert's book, Crossing the Rubicon, which is one of the most excellent books I've ever read. I highly recommend it. Learning a lot about 9/11 in that book. Okay, let's look at Dark Winter. This took place June 22nd to 23, 2001, portrayed a fictional scenario depicting a covert smallpox attack on U.S. citizens. Include journalists, include government officials, so on and so forth. Key players. I underlined some that I found interesting. Director of Central Intelligence, Director of Federal Emergency Management Agency, Director of Federal Bureau of Investigation, NBC News, Pentagon producer, CBS News, reporter, New York Times, reporter freelance, a lot of reporters, a lot of government officials there during these simulation exercises of pandemics or bioweapon attacks. Not much difference between a organic, naturally occurring pandemic and a bioweapon attack. It's essentially the same kind of thing they're looking into. Dark Winter exercise was a collaborative effort of 4 organizations. I thought it was interesting to note John Hopkins is involved in a lot of these, if not all of them. And John Hopkins is one of the ones working with the president and the government right now. Let's see what further they have to do with this. About the exercise, June 22 to 23rd, Center for Strategic and International Studies and the John Hopkins Center for Civilian Biodefense Studies. There's a whole center, folks, for civilian biodefense studies. Let me read what I have in the box down below. With tensions rising in the Taiwan Straits and a major crisis developing in Southwest Asia, a smallpox outbreak was confirmed by the CDC in Oklahoma City. During the 13 days of the game, the disease spread to 25 states and 15 other countries. 14 participants and 60 observers witnessed terrorism/warfare in slow motion. Discussions, debates, some rather heated, and decisions focused on the public health response, lack of an adequate supply of smallpox vaccine, roles and missions of federal and state governments, civil liberties associated with quarantine and isolation, the role of the Department of Defense, and potential military responses to the anonymous attack. Additionally, a predictable 24/7 news cycle quickly developed that focused the nation and the world on the attack and response. 5 representatives from the National Press Corps, including print and broadcast, participated in the game and conducted a lengthy press conference with the president. Findings. An attack on the United States with biological weapons could threaten vital national security interests, massive civilian casualties, breakdown in essential institutions, violation of democratic processes, civil disorder, loss of confidence in government, and reduced U.S. strategic flexibility abroad are among the ways a biological attack might compromise U.S. security. And at the bottom, I underlined where they say could result in hospitals being overwhelmed and becoming inoperable. Now, like they didn't know about these hospitals were going to be overwhelmed and packed full of people. They couldn't have known. Dealing with the media will be a major immediate challenge for all levels of government. Information management and communication, in other words, dealing with the press effectively, communication with citizens, maintaining the information flows necessary for command and control at all institutional levels, will be a critical element in crisis/consequence management. Should a contagious bioweapon pathogen be used, containing the spread of disease will present significant ethical, political, cultural, operational, and legal challenges. Okay, folks, now we're looking at the Clade X exercise from May 15, 2018. Again, Johns Hopkins is involved. The purpose of the exercise was to illustrate high-level strategic decisions and policies that the United States and the world will need to pursue in order to prevent a pandemic or diminish its consequences should prevention fail. Again, I circled the Bloomberg School of Public Health, Johns Hopkins. They're all in it together, folks. Are you starting to see the connections between these people? Okay, now we're looking at Atlantic Storm. How would world leaders manage the catastrophe of a fast-moving global epidemic of deadly disease? Atlantic Storm was a ministerial tabletop exercise convened on January 14, 2005 by the Center for Biosecurity of the University of Pittsburgh Medical Center, the Center for Transatlantic Relations of the Johns Hopkins University, and the Transatlantic Biosecurity Network. The exercise used a fictitious scenario designed to mimic a summit of transatlantic leaders forced to respond to a bioterrorist attack. These transatlantic leaders were played by current and former officials from each country or organization represented at the table. There was an audience of observers from governments on both sides of the Atlantic, as well as from the private sector, but the venue was designed to focus all attention on the summit principals and their discussions around the table. Now, let's take a look at Event 201. This is something we're all discovering now that took place on October 18, 2019. Bill and Melinda Gates Foundation, again, Johns Hopkins, are involved in this another global pandemic tabletop simulation exercise. Let's look into this. Again, October 18, 2019, just a few months before the pandemic broke out. And here's something you're going to find really interesting. Event 201 scenario. Event 201 simulates an outbreak of a novel zoonotic coronavirus transmitted from bats to pigs. Folks, I hope you're understanding what's really going on here. And I'll link to all these if you guys want to look into them further, and I suggest you do. Let me read to you the bottom of that page on Event 201. The scenario ends at the 18-month point, with 65 million deaths. The pandemic is beginning to slow due to the decreasing number of susceptible people. The pandemic will continue at some rate until there is an effective vaccine or until 80 to 90% of the global population has been exposed. From that point on, it is likely to be an endemic childhood disease. And what does that mean, folks? We're going to have to inoculate vaccinations for the children. This will become a standard vaccination for children across the world. Who is going to profit for that? Who will profit from these vaccines? I ask you, ladies and gentlemen, and I'm going to finish this video up. Folks, I hope you understand what's going on. They are intentionally not responding to this virus. I've proven this here that they run exercises on biowarfare all the time. Not much difference between a virus bioweaponized and intentionally released and one that occurs organically, naturally. It's essentially the same principle. So for Donald Trump and the government to say they couldn't have foreseen this, couldn't have prepared for this, we have no contingencies, we have no warehouses full of equipment, folks, that has to be one of the biggest lies we've probably ever heard on planet Earth. So I hope you spread this far and wide, and I hope you understand that this whole thing was pre-planned. I'm going to get into why they're doing this on the long scale, because it has to do with peak oil, and basically the planet doesn't have as much oil as we used to have, and everything's based off oil. Whole economies and whole populations are depend on and are based off of this resource, which is quite finite. Okay, folks, that's it. I've proven that the government is lying to you once again, and it's such a serious thing when lives are being lost, isn't it? So I hope you guys will take action, spread this far and wide, let as many people as you know what's going on. Okay, I've gone on too long. This is Patrick Penry. I appreciate you joining me for another episode of Diverging Perspective. Hey, stay safe, stay healthy. God bless. Over and out.
This was something that nobody has ever thought could happen to this country. I'm not even blaming. Look, we inherited a broken situation, but I don't totally blame the people that were before me and this administration. Nobody would have ever thought a thing like this could have happened.